Perspective on Florida Gateway College Television is sponsored by Potash Corp of White Springs. Potash Corp, helping nature provide.
Hello everyone and welcome to Perspective. This is a public affairs presentation of Florida Gateway College. My name is Mike McKee and my guest on the program this evening represent the Lake City Medical Center Cardiovascular Institute and the Cardiovascular Lab at the Lake City Medical Center. We have Katie Croft, who is Director of the Cardiovascular Services at the Medical Center, and Trish Millard. She is the Chest Pain Coordinator. All important people to know when you're having a heart attack. We'll talk with them when we come back. Don't go away.
Oh, look, a redhead.
Staring contest.
You still got it.
I know.
Come alive with the forest.
The dad was cute.
You were looking right at us.
Visit discovertheforest.org to find a forest near you.
Welcome back to Perspective on Florida Gateway College Television. The Cardiovascular Institute is a group of physicians that work out of Lake City Medical Center in the Heart Cath Lab. Representing them today is Trish Millard on the end. She is the Chest Pain Coordinator at the Medical Center, and Katie Croft, Director of Cardiovascular Services. Welcome to the program.
Thanks for having us.
Now, we had one of your surgeons here. We had Dr. Rourke on several months ago, and he was talking about what was going to happen at the Medical Center. And then it's happening. So, Katie, tell us the good news. What's happening at the Lake City Medical Center that folks who have a heart condition need to know?
So excited that we are able to offer this service. Dr. Rourke is our medical director at Lake City Medical Center, and he pretty much has head up our cath lab for the last few years. We started diagnostic caths in 2003 in Lake City. We moved into the hospital the end of 2014, and we are now able to offer the community interventional services that we've never been able to offer in this area before.
Now talk about the difference. I know that when you're talking about diagnosing, that's one thing, but when the renovation happened at the medical center, you kind of moved everything inside the hospital, right? So what can you do differently than you could before?
Well, we're in-house now, and our interventional cardiologists with the Cardiac and Vascular Institute are able to diagnose patients with heart disease in the middle of a procedure, and we are now able to fix issues that we find rather than having to send our patients down to North Florida in Gainesville. And
so if you've got a couple stents that you need, and the stent is, for those of you who don't know, is your is it artery, is it a vein that's clogged with plaque buildup, or what exactly are we doing when we're doing the procedure?
When we are doing a heart catheterization, we are looking at the main arteries that supply oxygen to the heart. Everybody's anatomy is a little bit different. So when the physician is in looking to see if there are any blockages or anything that would be impeding blood flow to the heart, which is essentially what causes a heart attack, is when the oxygen is not getting, the heart's not getting the oxygen that it needs. We are able to find the issue and take a balloon in and open it up, and then oftentimes put a stent in that keeps it open if it needs that.
Well, I tell you what, this is TV and it's TV magic, so why don't we take a tour of the heart cath lab, and then a little later on we're actually going to get to see an actual heart cath procedure right here on Perspective on Florida Gateway College Television. So let's go take a look, and Katie's going to give us a tour of the heart cath lab at Lake City Medical Center.
I'm very excited to be giving you guys a tour today of our new cath lab. We have the tile right here splits, if you can see. The lighter tile was where the hospital used to be, still is obviously, and then the new part is where it changes into darker area. This is what we added in December, so we've been in the hospital 4 months now, going on 5 months. With the expansion of the emergency room and the addition of the cath lab to Lake City Medical Center, we have a new emergency transport services entrance and exit right here. I wanted to show you guys how great this is. Not seen anything like this as far as a covered walkway. So our emergency room is right here. Our ambulances are able to pull in through the loop right here, transport patients in and out of here. And we're just that close to the emergency room. It's been very convenient. Our staging area is this way. So when you are a patient here, you will come through here first, and we have bay areas. We have 4 bay areas that we take care of patients prior to and immediately following their procedures. Some of the procedures we do are at bedside, so patients would stay in this bed space throughout the duration of their time with us. We have 4 of these. We have great flat screen TVs. That's always an added bonus for a patient that has to be here for a while to be able to watch television. I just think the artwork is beautiful. This is a nice, new, clean facility that they've given us opportunity to take care of our patients with. This is our nursing staging area. We have Star and Lisa, 2 of our cath lab nurses, long-term cath lab nurses. Physicians sit here too. Like any other nursing station, we're just kind of doing computer work. Everything is computerized now in our healthcare industry. And then we have a beautiful new lab. I will have to say that we have better equipment than most hospitals in North Florida. Lake City Medical Center really did it right when we moved into the hospital. We have state-of-the-art equipment. We have stuff that our sister hospitals do not have. I would like to highlight the big screen TV. This screen actually has 8 feeds to it, which we can plug different things into, and the doctor can see everything at once. You can plug your laptop in and watch the Duke game if you're Dr. Rourke, which we try not to do in our patient hours. But the advantage to this screen for the physician and the patient is radiation exposure. Having a larger screen decreases the radiation exposure at least by 3 times, if not more. Everything else in the lab, we have the same equipment next door, but the x-ray equipment is just top-notch. We have integrated systems. We have one of the first in the state of Florida for when we're doing intervention to allow the physician to see within the vessel to know where to put the stent or where to open up the artery when there is a blockage, which is new. It was new to the state of Florida, but new to us too, and the physicians are getting used to using it. And now we're going to come into our control room. And we're going to come in here. This is where we have a nurse or CVT watching the patient's rhythm, watching the patient's images with the physician and other members of our team in the room. There's typically at least 1 person back here, if not 2. So we have eyeballs in the room and outside of the room while procedures are going on. Thank you guys for letting me give you a tour of our staging area and our lab, and we hope that if you need healthcare in the future that you come to Lake City Medical Center.
Wow, that's pretty neat. And again, the fact that the heart cath lab is now in the hospital, and that's just to protect the patient in case there are complications that happen during the procedure, that they're going to be taken well care of.
Exactly.
Now talk about, we're going to see a heart cath procedure here in a few minutes, but if going through the procedure you find out that you may need to have a bypass surgery,
Right.
then what happens? What happens to the patient then?
Typically, the physician will speak with the patient and the family, and we like to refer our patients to our sister hospital. We have the same group of cardiologists between Lake City and North Florida, so we know that we can have a good continuum of care with the patient. We will send them, of course, to their facility of preference, but we would send them to North Florida for open heart surgery. We are doing intervention at Lake City Medical Center, which the stent and the angioplasty that we were just discussing, without surgery on site, but we have a sister facility that does have surgery on site, so we are sending our patients to North Florida for the most part.
Well, Katie, let me ask you how important that is. As a heart patient, and I've never been a heart patient, but it seems like the continuity of care, and when I say continuity, I mean the same docs that are looking at me here are going to be the same docs that are going to be in Gainesville. How important is that for the patient's state of mind to have that ability?
In talking with patients, I think it's fantastic. We have a physician in Lake City that has a partner at North Florida. They're talking to each other, so when the patient enters the facility at North Florida Regional, the doctor knows who they are, they know that they're coming, they're expecting them at that facility, and I think it really helps the patient with their ability to be comfortable in their family, knowing that I have the same group that's taking care of me here and there.
And and as you get older, we all are getting older, and having to explain the situation to several different people sometimes gets frustrating for a patient. So I mean, when you're having to deal with the same people who are talking to each other, it makes people feel a little bit, maybe makes them feel a little more confident during a most stressful time in their life going through this type of procedure.
I think so.
Let's not delay anymore. Dr. Rourke was very gracious. He's done several of these heart cath procedures at Lake City Medical Center in the new heart cath lab. Very gracious and allowed us to go in and actually videotape a procedure, and that's what we're going to look at right now. A little scary for me actually being in there and doing the video work, but let's take a look at an actual heart cath at Lake City Medical Center.
We're going to go do a catheterization on a patient that I saw in the clinic here in Lake City 2 weeks ago. He's an elderly gentleman, 82, who's been perfectly fine, but came in with symptoms of heart failure, which means he was having trouble breathing. We did an ultrasound or echo test to look at his heart, and his heart was pumping fine, but it looked like he had a leaky mitral valve, which was a new finding for him. And if the valve leaks badly enough, then that can lead to heart failure, where the pressures rise in your heart. They can then back up into the lungs, and you can fill up your lungs with fluid and have shortness of breath. So we're going to go in and we're going to measure the pressures in his right heart with a catheter called a Swan-Ganz catheter. Then we'll look at his heart pumping function, and then we'll look at his arteries. So we'll go in the artery and the vein in his groin on the right side. Angela, nurse. We have Johnny, our tech, and Donna, our nurse. So what we're doing today is a catheterization to the patient has a leaky mitral valve, so that's called mitral insufficiency. So we're going to go up and look at his heart pumping function. We'll look at the amount of leakage of the valve, and then we'll also measure pressures in the right side of the heart. So we're going to do a right and left heart catheterization. So that's a little bit more complicated than our normal cath. But we're ready to go. We have our whole team here. We do what's called a timeout before we get started so that everybody knows we're on the same page. First step we're going to do is put a little numbing in here. You ready for a little numbing there? Pinprick and a bee sting here. You can't drive today. Okay, so then we're going to try and put the needle with some numbing into the vein here, which it goes right through his groin. So I've got my finger on the artery. We put a little numbing as we go forward. Let's just look at that wire, Jenny. It's a little tough going up. So we're going to look and make sure on the x-ray that the arteries, that we're going in the right direction. We are. Okay. So we're going to put this little wire through here, which is a little stiffer, and hopefully we can then guide our catheter out over the wire. And you'll see the wire come out the tip of the catheter here in just a second. And the other thing we're doing that I guess we should tell you is when we're looking on that big screen there, is that's X-ray. So it's an X-ray movie image. So I'm controlling the X-ray on and off with my foot. So there you can see the wire just came out the tip of the catheter. And then I'm going to try and advance, and now my catheter is advancing over the wire. There we go. Perfect. Okay, so that's where we want to be now. Let's just measure a wedge pressure, Kelly, once we get here. Can we zero the Swan, please? And we hook up. So we're going to measure pressure now. Can you zero the Swan?
Yeah, open it, and you want to just zero one or both.
You can look up at that top right where the blue and the orange is for the Gators. Go Gators. And watch yourself now. Okay, let's just measure a wedge pressure for me first. Go 0 to 50, Kelly, or 40. So that little blue line is the pressure in his pulmonary artery that's reflected back from the left atrium. So that's called a pulmonary capillary wedge pressure. Okay, you got it, Cal? And then I just...
Y'all ready to do outputs?
Oh, let's see, here we are. Okay, that's PA. Go ahead and measure that as PA. So now what we're going to do is we're going to hook the end of this catheter up to a device here, and we're going to inject room temperature saline through the catheter, and then there's a sensor on the end of that catheter that will detect temperature change, and based on the amount of temperature change, it'll calculate how much blood his heart's pumping per minute. So when I inject, which is going to happen in just a second, okay, the curve is going to be on that top right graph there. So I'm injecting now, and you'll see a white line come across there. Here it comes. And as that goes up, that's going to be reflective of blood flow through his heart. And then in just a second, there's going to be a number pop up there that'll tell us his cardiac output. So it's, I don't know if you can hone in on that, it's 6.3, so that's very normal. Normal should be sort of 3.5 to 5, so his is a little higher than normal. So now we're going to go up through the arterial sheath with a catheter. This is called a pigtail catheter. It's got a little tail on the end. Johnny will lead with the wire. Push that wire out, John. And so we'll go up, and we're going to put this up across his aortic valve into his left ventricle. If you look at the x-ray, we're coming up. And Johnny's got that wire right above the aortic valve now. So then I'm going to turn the catheter a little bit and try and flip it into the left ventricle. So there, it just jumped in there. So now we went across his aortic valve, and you can see our Swan-Ganz catheter, which sort of has the backwards C shape, and then the pigtail catheter in the ventricle. And we're going to then hook this up to pressure as well, and measure pressures in his heart. So you can see we have the Swan-Ganz catheter in the right heart and the blue or pigtail catheter in the left heart. And then again, Kelly's measuring pressure up there. You want me to see if I can get a wedge for you, Kel? So now what we're going to do is we're going to pull the pressure catheter back in the right heart. Do PA again for me, Kelly. That looks a little better.
I got it.
Okay, here comes RV. So if you watch the Swan-Ganz catheter on the x-ray screen, I'll show you. I'm pulling back here. I'm right above the pulmonic valve, and I'm going to drop it here into the right ventricle, and then Kelly will measure the pressure in the right ventricle. So if you look at the blue and orange, the pressure tracer, the blue looks different now because we've dropped into the right ventricle. Okay, so now what we're going to do is we're going to start taking pictures. So Johnny will move the camera. If you see the gantry there, he's going to bring it over. We call this RAO, which stands for right anterior oblique. And so we're going to look. Our catheter sitting there, we set right. Yeah, that's good. So we're going to look here at the pumping function of the heart, and then we're going to look at the mitral valve. So just pan over, okay? So Johnny's controlling the table. In this button, I control the contrast, and I'm just holding on to the catheter. So we're taking a low resolution. Now we're going to take a movie picture. So here comes the movie. Okay, so you can see the black there. It'll replay over and over again. That's the black is his heart pumping. And it's hard to see, but there is some mitral insufficiency. It goes off to the left there, sort of where that catheter, the angle of the catheter is. This is a picture of his heart pumping. So that's the heart there. If he had a lot of mitral insufficiency, we'd see the atrium light up right over in here, and it doesn't look like it's lighting up much. So probably he doesn't have as much as we thought by echo, so we will treat him medically. We also looked at his arteries, and as I pan through here, he's got some minor blockage, but nothing that's critical for 82, so we can treat that with medicine as well. So from his standpoint, good news, medicine and not heart surgery or balloons or stents.
Wow. Again, being able to be there and see it, I hope that the people at home will see that it's come a long way, Katie, has it not? I mean, in the old days when my father was a heart patient, you used to have to put, you would go through the femoral artery, and so weight had to be placed on there, and you couldn't move. And now the changes in medicine are just unbelievable.
It is a wonderful thing. I would say that we are probably doing between 60 and 65% of our patients, we're going through the radial artery, which is in the arm, and it alleviates the time that patients are having to lay flat on their back with the sandbags and the things that you were just discussing. We're doing intervention the same way. Many of the cardiologists are trained to do cases radially, and it's just a better patient experience.
And it's better for the state of mind for the patient. Again, the healing process, we've talked about this before. If you can have your family not have to make the drive to Gainesville, that's stressful in itself for older folks to navigate I-75, to drive to Gainesville to see their loved one. Here, it's just, you're done.
Here.
And you say, how long does a typical procedure take?
A typical case is somewhere between 10 and 20 minutes. Diagnostic, if we end up having to fix something, of course, is a little bit longer. Most of the physicians are, very quick within under 30 minutes, I would say.
Well, we appreciate the opportunity to videotape this and show the public just what is going on at Lake City Medical Center, the strides that, and the commitment that the administration has made to Lake City and Columbia County. They went out and they did surveys. They said, what type of medical treatment does this community require? And they went out and did it. And Mark Robinson, the ex-CEO at the Medical Center, kind of had a vision for that. So now we're going to get to Trish. Trish has been sitting quietly at the end of the couch. She is the chest pain coordinator. Talk about what a chest pain coordinator does.
A chest pain coordinator collects lots of data, improves processes, procedures to ensure that when you come in our emergency department via EMS or walk through the door, that you get the fastest, most efficient treatment possible.
Now, so when someone's in distress, you're trying to make that process to where they're not getting even, and I don't want to use the word freaked out, but I mean, when you're in distress and you're hurting and you don't know what's going on, that's what your job is, to make that, to at least let them know what's going on and streamline the process.
Right, we have processes in place that if you walk in our door and complain of chest pain, you go straight to a room, you get an EKG immediately, and the EKG is the only way to determine if you're having an acute event.
Now, you went through an accreditation process. Now, I didn't know that there was an accreditation process, but you did a lot of data. Talk about that process, and you've been accredited, which means this is something that not many places have.
Yes, we are the area's only chest pain accredited center. It is very difficult to obtain. There's lots of data collection. We submitted a binder that was over 1,000 pages of community education. They're very specific requirements. Community education, collaboration with EMS to improve relationships and processes for them bringing you to the emergency department, the processes within the hospital, the time frames it takes for you from the door to your EKG till you get it upstairs, the length of stay for your testing. There's lots of specific things, from cardiologists all the way down to the staff.
Now, part of what you did in this accreditation is you couldn't not have a cardiologist available all the time, right? And explain to the people that if you don't have a full-time cardiologist, when at 2 o'clock in the morning when you're having a heart attack, there's a wait time and there's discomfort. And so talk about that. Now we have cardiologists on call 24/7.
24/7.
We do have cardiologists on call 24/7. And currently we are doing intervention, but we don't take care of the acute heart attack patient in our cath lab. Those patients we still transfer to North Florida or their facility of choice. But when you come in our ED, if we do, because our processes are in place and our time frames are there and we do the EKG in a timely manner, you're transferred and can have intervention within and save your heart tissue.
Now,
the sooner you get to the cath lab, the better off you are.
Well, and let's talk about another thing that saves heart tissue, which is important. When that dies, it doesn't regenerate. But talk about in the EMT, in the actual units, there's stuff in there that's telling the doctors what's going on.
Yes, they have life packs. When they do your EKG in lifeguard ambulance here, they have the capability of transmitting that EKG to our emergency department. The ED physician can pull it up on the screen. If it's something that our hospital is not equipped to handle yet, we will be there one day, they will bypass us and you'll go straight to North Florida Regional.
So that could save lives.
Yes.
That's really important, and the medical center is in the forefront of having that into the rescue units. This is great news. 20 years ago, did anyone ever think that a hospital in Lake City would be doing these procedures? I don't think anybody thought. But medicine has advanced to the point where, and a commitment from your cardiologist. I mean, it really, Katie, talk about the cardiologists and how special they are that they are willing to come to Lake City to serve the patients here.
We started, it's been almost a year. They made a commitment with our previous CEO to be on call 24/7, and they are available to us 24 hours a day, 7 days a week. Their commitment level has helped build this program, and they want to be able to take care of the patients in this community and have the patients and their families stay within this community. We were very fortunate in the last few months when we started intervention to bring on a new cardiologist, although he's old to the community of Gainesville. He spent several years in Thomasville, Georgia, piloting a program and figuring out what works and what doesn't work when you're offering intervention at a facility that does not have surgery on site. He's well versed and well experienced in that and knows what patients and their family members go through when they have to travel to facilities that are not available to them really close by. So we're really happy to have him on board. He's up here 80% of the time taking care of our patients. And it is really a good thing that we have intervention here, but we have our sister facility that has the surgery on site.
And it's 45 minutes, and it's probably a lot quicker in the ambulance when you're going.
It is, and I think that's part of our chest pain accreditation, which Trish has been working on for the last 2 years in developing those relationships and making sure that we are accredited for a reason. We have processes and protocols that allow our patients to come in, and we can make better decisions to take care of them quickly. If we can't take care of it here, we take care of it in Gainesville as our sister facility. And it's the same physicians, it's the same program, the same process. It's just we've expedited the care of the patient.
And both of you feel very comfortable sending your loved one to have a procedure done there?
Absolutely. Yes. In fact, I've probably taken care of several of my loved ones. Being a native around here.
Thank you both for being on the program, and we wish you the best of luck with this. And I think it can only get better. And at some point, maybe not when we're around, but they'll be doing open heart surgery at Lake City Medical Center in the future. And thank you for watching Perspective here on Florida Gateway College Television. We hope you've enjoyed the program. Till next time, I'm Mike McKee. So long.